All right, so we've got the latest COVID numbers in, and as is often the case on a Monday, they are a fair bit lower. 6,381 new infections across the country, 4,488 Gauteng, and only 356 in the Western Cape. But I think a key number to look at is the positivity rate, which continues to climb. 26.4% of tests done in this cycle were positive, so that's still very high. And I'm joined now by Dr. Kerrin Begg, a public health medicine specialist at UCT's College of Medicine. Kerrin, always great to chat to you. So we have seen the numbers today drop quite a bit. We do see this often on a Monday. Do you agree with me that the positivity rate is the thing to keep a close eye on, which is at 26.4% today?
So it is it's a combination of watching both positivity as well as the number of tests that are increasing. Because obviously, you know, if we're testing fewer, but we're only testing those that are symptomatic, then the positivity rate will go up. So we're looking at both the case rate, the positivity rate, as well as the admissions and death rate. And those all give us the kind of composite picture together. So obviously those cases are still rising dramatically in Gauteng, not quite as much, but as you were starting to say that we always are a little cautious when commenting on a Monday because the numbers do come in a bit slower over the weekends. Not only do they come in a bit slower as we gather data, but also people tend to test because government centres are predominantly open on weekdays, and so there isn't as much access to testing as well on a Saturday and Sunday, a Sunday in particular. So we're watching all of those closely. We are seeing that the hospitalisation numbers are not increasing yet quite as dramatically. They do tend to lag case increases by about 1 to 2 weeks. So we'll really start to see whether this is going to affect particularly admissions and ICU admissions from next week onwards. But for now, it is a relatively slower slope of increase in admissions than it is in cases.
Would you agree with Dr. Farid Abdullah from the SA Medical Research Council that the demographic is changing, that it is people under 50 who are being admitted to hospital? He does caution that most of them, the symptoms are not severe and they don't need oxygen, whether that's because they've been vaccinated or simply because they are younger and more able to deal with the variant, or indeed if Omicron is less severe, of course, is a little bit unclear at this stage. But do you think the demographic is going to change inevitably?
That is what we're seeing. And once again, it's always caution that we interpret that in the early days of a wave, because we don't really see the impact of admissions until at least a week to 2 weeks following the ramp up in cases. But certainly what we're hearing on the ground and what we're seeing both in the figures that the provinces are reporting as well as the NICD is that we are seeing a much younger profile. We hope, but time will tell, that is because the bigger numbers of vaccinated individuals do sit in our older age groups, because they were the age groups that we targeted first for vaccination. They were the age groups that were most at risk, and so therefore targeted. And so we may well be seeing the admissions of those who are not yet vaccinated. That certainly also seems to bear out what we're hearing on the ground, that the majority of those admitted have been those that are unvaccinated.
Yeah, the point that Dr. Farid Abdullah is making as well is that even if it is a less severe strain or we have better protection from natural immunity or from the vaccines, the truth is with this high caseload, which seems to be coming on very quickly, we are still going to have hospitals really battling, because there will be a proportion of people who get very ill and who die. Would you agree that our hospitals still need to be going full throttle with ramping up?
Yeah, I mean, I think that's something that we'd really hoped to avoid in this wave. We'd really hoped to get to at least 2/3 of the population, of the adult population, vaccinated by now, that we could have a lower peak to the fourth wave. But sadly, we haven't got there. It is encouraging that we're seeing significant increases in vaccinations as people are obviously getting a fright and going. But we really do need those as quickly as possible. Of course, it does take 2 weeks to get that immunity built in, so it may be a little late. We're certainly seeing some people who are getting positive, who are becoming infected now, even though they've very recently been vaccinated. And so, it's similar to when is the best time to plant a tree? Well, 2 years ago, but right now is the next best. And so vaccinated is much the same. It was best a few months ago, but right now is second best. So please go and get vaccinated.
Yeah. The President saying today in his newsletter, obviously also calling on everyone to get vaccinated who has not, but also saying, flagging concern around indoor spaces. Do you think, and you're a public health specialist, you've watched this virus, you've seen its mutations and how the public has responded to any sort of lockdowns, restrictions, what works, what doesn't work. What do you think would work as the, bearing in mind that we know that the National Coronavirus Command Council is going to be meeting this week, probably midweek. We're likely to see some sort of restrictions coming into play. Having watched all of this, the way the virus works, the way people behave and respond, what do you think is the most workable, practical solution to give us the best chance of getting through this wave without destroying people's livelihoods?
Well, I think that one of the opportunities is that it's summer, and we really need to be in spaces that are well ventilated. More and more, the evidence has pointed to the fact that not only is this droplet and aerosol spread, but probably air, which means that we really need to be in spaces with good ventilation. So preferably outdoors. So the best thing that everybody can do is wear your mask, be outdoors, and get vaccinated. Are pretty much the three best things that you can do. The next best is that if you are inside, to really make sure that the spaces are very well ventilated. Leave doors, leave windows open. Have a gale inside, but rather the gale that it can blow away the viruses than actually be indoors. So we're back again to avoiding the 3 C's, which are avoid closed spaces, confined or closed places, confined spaces, and crowded spaces. So avoid crowds, make sure that you're not close up to anybody indoors, and make sure that they're not confined anymore. So lots of windows, lots of ventilation. Make sure that if they are if it is ventilated through air conditioning, that it is fresh air that's being pumped in and out, and not that it's recirculating, because effectively in that space you're potentially having a worse situation with recycled air.
As a public health specialist, do travel bans work? Does the closing of beaches work?
So closing of beaches is probably futile. We actually want people to be outside. So outside is far better than inside. We'd far rather restrict gatherings and restrict proportions, closely populated people in closed environments. So rather shut down gatherings that are indoors. If you are going to be outdoors, it does help to try and mitigate crowds. So we certainly wouldn't want big crowds. So the kinds of, I would suggest that the only beach bans that may work are those where we know that there's massive crowding on a particular day, such as New Year's Day. But in terms of a blanket ban, really doesn't make any sense whatsoever. In terms of lockdowns and travel bans, that was a very blunt instrument that worked in the very early parts of the epidemic, when we were trying to make sure that we didn't spread the virus. Effectively now it's spread. So right now those are really pointless and really only serve to cause the harms probably outweigh the benefits because we're not really going to see the benefits in terms of restricting movement of the virus at the moment.
Thank you so much, Dr. Kerrin Begg, Public Health Medicine Specialist at UCT's College of Medicine.